Gentlemen, listen up. In the United States right now, 1 in every 8 men will be diagnosed with prostate cancer at some point in time in their lives. And when we get older, the greater the chance of developing it.
The good news is that about 80% of prostate cancer cases are detected early while still localized to the prostate. However, prostate cancer can sometimes spread or return after treatment, becoming advanced prostate cancer.
Crazy. Well, the field of immunotherapy in prostate cancer care has grown exponentially and is now considered to be a major pillar of treatment, offering patients many more options than ever before.
Today, we'll explore an even more personalized approach for those living with advanced disease.
Well, I was born and raised into an Air Force family. Dad was career Air Force. When I got to college, I did ROTC Air Force, and then after that went on active duty as a nuclear weapons officer. And then when that was finished, I decided to continue in the reserves. Now I find myself to be 71 and still working in the defense industry. And Amelia and I have been married 15 years, and she has a son, and I have children. We've got a very good time in our life with grandchildren starting to show up. Family is a gift. When we travel, usually the first thing we think of is, who can we go see? When I was in my 50s, I had some mild symptoms that the urology clinic was sending me for lab work 4 times a year, and they tried 1 or 2 therapies, and I would improve, and then they would try biopsies. They would come back clean. So it was kind of unknown what really was amiss in my case. And one time between a quarterly routine test, I went from a PSA of 60 to a PSA of 965, and that was no longer a routine indication.
Prostate cancer is the most common cancer in men, and like any cancer, it can be progressive and become life-threatening, and it usually affects men in their 50s or older, more common in the 60s and 70s. We do know that there's a higher risk in African-American men, and if there's been a family history of cancer. Also, if there's a family history of breast or ovarian cancer in women in the family, there can be an increased risk of prostate cancer in men. Prostate screening usually involves an exam of the prostate and a blood test called the PSA, or the prostate-specific antigen. PSA is a protein that's made by normal and cancerous prostate cells, and what we know is that there are certain conditions that allow more PSA to get into the bloodstream, and cancer is one of them. When the PSA is abnormal, we generally want to recheck it to make sure that it's a valid number, so we don't want to really rely on a single PSA. But if the exam or the PSA suggest a higher risk of cancer, the next step is generally going to be a biopsy. It may also include an MRI, but what we're trying to do is target areas within the prostate that possibly harbor cancer. If we wait for signs or symptoms of the disease, it most likely is not curable and may have already spread. So especially for prostate cancer, this process of early screening and a biopsy to determine if there's cancer is really essential to the long-term outcomes for the disease.
I picked up the phone one day and called Chesapeake Urology, and she gave me the name of Dr. Lowentritt. And I came in that next day, and I had a brief 1-page summary, and I saw his eyes when he got to the current situation. And he said, I have to start treating you right now. And so we did a biopsy right away. Dr. Lowentritt diagnosed me with advanced prostate cancer, and then when they would do images, they would see metastasized to the bone. At first I thought, that is not me. I do not have advanced prostate cancer. And the tests kept coming back. I finally got up the nerve to ask him, how long do we have here? And Dr. Lowentritt told me we had about 3 years.
There are a certain percentage of those patients that either will have the disease recur after treatment, or unfortunately, when they first present with their cancer, already have cancer that has spread. And when the cancer is no longer in a curable state, we consider it advanced prostate cancer. And that's generally this recurrent or metastatic prostate cancer that's spread outside of the prostate. Even though we consider that advanced prostate cancer is not curable in most men, that doesn't mean we don't have some very active and effective treatments to slow the cancer down, to prevent any symptoms or reduce any symptoms that may have shown up, and to give a very high quality of life and hopefully a long quantity of life for many patients.
Hearing you have advanced prostate cancer can be daunting and a scary diagnosis. However, the prognosis is not as dire as it once was.
Thanks to advances in medical research, innovative treatments, and precision medicine, living longer with advanced prostate cancer is increasingly becoming a reality.
For Glenn, staying informed was paramount.
I was feeling better, and after I got over the denial, I was just terrified. And there's things I wanted to do, things like I felt I had to do, and 2-3 years is not enough time. My mission was to do some reading and speak with people who have succeeded and find out what they did locally, something I could access. A lot of agreement from many sources about the broader the approach, the better it should be for you, which is meditation, which is faith, which is acupuncture, which is organic food, which is avoiding ingesting chemicals. I had a supportive group of doctors, Dr. Lowentritt, and he supported what I wanted to do.
In Glenn's case, he presented at a time when it was somewhat overwhelming. He had widespread disease. It was unexpected. He was young. It was, really a challenging time. And one of the first things that we did was we started to talk about what his expectations were and how he wanted to go through this, and really look at the holistic journey that he wanted for himself. And a lot of it involved plugging him in with some of the other support groups and services that we have, while we also tried to address what we were seeing with his disease medically. Prostate cancer is very clearly one of those diseases where shared decision making is important. And that means that as a patient, you have a very important voice, because in almost every situation, we don't know that there is truly a benefit of one treatment over another. So the patient really can choose for themselves, once they understand what some of the different side effects or other effects may be, what is best for them.
Dr. Lowentritt, he was very helpful, and he treated me with no chemotherapy. Sometimes I would go to the library and get books about immunotherapy, and it was very hopeful throughout the world. Urology was moving at lightning speed with new therapies and new test results, new study results all the time. So at least there was hope something could come along. And frequently it did.
When a patient presents with advanced prostate cancer, with metastatic prostate cancer that's spread to other organs, the foundation of treatment is hormone-targeted treatment. What we know is that testosterone is the male hormone, feeds prostate cancer. And when we can restrict testosterone, we generally can slow the prostate cancer down. At a certain point, though, we know that the disease progresses and it becomes resistant to those treatments, and that's when we call something castrate-resistant prostate cancer. When a patient progresses on to metastatic castration-resistant prostate cancer, that's when the disease is really getting serious and life-threatening. Thankfully, it's also a time where we have a lot of therapies, both now and coming, that are targeted directly for that patient.
When we come back, how precision medicine is targeting advanced prostate cancer. Welcome back, everyone. Immunotherapy is an emerging and promising approach in the treatment of advanced prostate cancer, evolving alongside traditional methods such as surgery, radiation, and hormone therapy.
And this is due to the ever-growing understanding of the role that the immune system plays in cancer.
Joining us now with more on the subject is Nadeem Sheikh, Vice President of Research and Manufacturing Science with Dendreon Pharmaceuticals.
Thank you for being here, sir.
Thank you for hosting me.
Look, many people have heard about immunotherapy. Let's talk a little bit about how the role that the immune system actually plays in cancer.
It really goes back to the AIDS epidemic, when we saw that men, unfortunately, who came down with AIDS were manifesting with these very rare cancers. The missing link was that their immune system was not functioning anymore. So that's what established the role of the immune system fighting off cancer. Cancer is emerging in our body every second of the day. And the immune system is eliminating those cells. However, some cancers have the ability to either hide from the immune system, they downregulate receptors that the immune system can recognize, or they will secrete factors that actually just blunt the immune system. So therefore, the cancer can outgrow the ability of the immune system to detect and eliminate the cancer.
And going back to what you said regarding AIDS 40 years ago, you were there. Dendreon Pharmaceuticals was pivotal at that moment,
Yes.
right? Behind the scenes.
Now, we started off over 30 years ago and trying to understand how to use immune cells to fight off AIDS. And that was our basis of our origin. As the field evolved and we started understanding the role of the immune system in cancer, we decided to harness the immune system to fight off cancer. We believe in immunotherapy, and we were the first to have an immunotherapy on the market.
Wow. Let's take a little break and we'll hear some more, okay? We'll be back right after this.
Coming up, activating the immune system against advanced prostate cancer. We're back with Nadeem Sheikh from Dendreon Pharmaceuticals. We were talking earlier about the role of the immune system in cancer.
Let's talk a little bit more about leveraging the immune system to fight cancer.
If we think about the immune system, you've got various cells. They have to work together when they're fighting off an infection. So our approach really was harnessing the immune system in its totality. Let's take the immune system out of the patient and reprogram it. So reprogramming is basically harnessing the immune system in a very similar fashion to when you get an immunization or a vaccine. What happens is when you get a vaccination or immunization, you're using the entire immune system, not just specific components. They all work together. An army, a defense force, will take the cells out of the patient through a procedure called a leukapheresis. Very simple procedure, extracts white blood cells, which are the cells of the immune system. We'll train them to be specific in recognizing prostate cancer cells. A couple of days after we've done this, the cells are then returned back to the patient. The patient is the treatment is the patient.
And Nadeem, this therapy is available as a treatment to certain patients with advanced prostate cancer, correct?
Correct. It's known as Provenge. Its clinical name is Sipuleucel-T, and it's indicated for asymptomatic or minimally symptomatic metastatic castrate-resistant prostate cancer.
Nadeem, thank you so much for being here with such great information.
Thank you.
Absolutely. We're going to go back to Dr. Lauren Tripp and get a little bit more information about Provenge.
Take a look.
There are three main reasons why I really like using Provenge as my first-line treatment for patients in the metastatic castration-resistant prostate cancer phase of their disease. Number one is it's a very well-tolerated treatment. There certainly are some potential side effects, as there are with any treatment, but generally people tolerate this really very well. The second reason that I like this is that it's a fairly fixed duration of treatment. It's generally 3 treatments over anywhere from 3 to 5 weeks of time frame. So most patients get through this fairly quickly and they're not having to go through long-term continued treatments. And the third reason I really like this is because of the mechanism of Provenge and it building up the natural defense and the natural immune system to fight the cancer. We don't have to worry about interacting with other medicines the patient may be on. And it doesn't limit us in any way in what future direction we may want to take their cancer treatments. So it really is, in some ways, another foundational treatment that anything else can be laid on top of. The most important thing about Provenge is that in trials it was proven to extend the life of patients that took it. The other thing that I think is very important to set expectations with a patient is about the PSA. So the PSA remains an important part of helping us determine overall the direction the cancer is going in. With Provenge, the challenge is that the PSA doesn't directly reflect the effect of the Provenge itself, meaning that although people that receive Provenge live longer than those that don't, the PSA may continue to rise, and frankly, we expect it to continue to rise even after giving the treatment. It's just that Provenge works differently. The immune system works differently. It's not directly affecting the PSA, it's affecting the cancer itself. What I always do is kind of look back and say, hey, did we give this patient the best chance? And when we have options that we know extend life, and extend life without harming quality of life much at all, I want to make sure that I've given the patient as many of those options as possible.
In the 2011 timeframe, I was having not good lab results, and Dr. Lowentritt advised me the clinical trial for Provenge was complete, and it was in harmony with what I wanted to do and what I felt was correct for me. I was the third or fourth person in Maryland to get Provenge. There was some fatigue, and I rested. It was very manageable, and I feel great. I have been able, with the guidance of Chesapeake Urology, Dr. Lowentritt, and the other doctors, to be around, which is what I wanted to be around. And now I have a grandchild, and things are wonderful. I'm looking forward to what's down the road.
Ask your doctor if Provenge is right for you. For more information on the latest research and support, visit the Prostate Cancer Foundation. And as always, you can go to our website, thebalancingact.com.
Provenge, Sapulus LT, is a prescription medicine used to treat certain men with advanced prostate cancer. Provenge is an established cellular immunotherapy and is customized to each individual by using his own immune cells. Important safety information. Before receiving Provenge, tell your doctor about any medical conditions, including heart or lung problems, or if you have had a stroke. Tell your doctor about any medicines you take, including prescription and non-prescription drugs, vitamins, or dietary supplements. The most common side effects of Provenge include chills, fatigue, fever, back pain, nausea, joint ache, and headache. These are not all the possible side effects of Provenge treatment. Provenge is made from your own immune cells, which are collected during a process called leukapheresis. The cells are processed, returned, and then infused back into the patient through an IV, intravenous infusion, approximately 3 days later. This process is completed in 3 cycles about 2 weeks apart. Each infusion takes approximately 1 hour and requires 30 minutes of post-infusion monitoring. Provenge infusion can cause serious reactions. Tell your doctor right away if you have signs of a heart attack or lung problems, such as trouble breathing, chest pains, racing or irregular heartbeats, high or low blood pressure, dizziness, fainting, nausea, or vomiting. Have signs of a stroke, such as numbness or weakness on one side of the body, decreased vision in one eye, or difficulty speaking. Develop symptoms of thrombosis, which may include pain and or swelling of an arm or leg with warmth over the affected area, discoloration of an arm or leg, shortness of breath, chest pain that worsens on deep breathing. Have signs of an infection, such as a fever over 100 degrees Fahrenheit, redness or pain at the infusion or collection sites. Tell your doctor about any side effects that concern you or do not go away. For more information, talk with your doctor. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see accompanying full prescribing information.